welcome to the Art of Being Human. We've been talking about drugs and drug addiction, and I'm going to continue with that, but I thought I would start off by showing you a book that's called The Diagnostic and Statistical Manual of Mental Disorders. This is it, if I can pronounce it. This is it, the DSM-4. Actually, there's a new one out, the DSM-5. So no one uses the real title. It's just like a mouthful, but they call it the DSM. This is a huge book. It comes out every few years, and it diagnoses and talks about every diagnostic disorder, every mental disorder that's known to man. And I do mean that seriously. There are lots and lots and lots of mental disorders. They're all coded. They're all talked about. The etiology is talked about. The symptoms are talked about. It's just a very, very complete book on mental disorders. And everybody uses it. Psychiatrists use it. Psychologists use it. Counselors use it. We all use it. And as in about every 8 to 10 years, a new one comes out. The DSM-5 is out. I don't have it yet. You have the DSM-4. If I were doing active counseling, I would just run out and get the DSM-5. But what they do is they fine-tune it. They may add some things. They may change some things as more and more knowledge comes about mental disorders. This is the book to use to diagnose. Now, it's really interesting because everything is done in code. So if you have a code, if you have an insurance form and you have a certain disorder, it's not written out, it'll be put in code. Like you have an anxiety disorder or something, it'll be 300 point something, 300.08 or something like that. And anyone who sees the code knows what it is. I had a situation where I was counseling somebody who was working in a school system, and she had a disorder, and of course what I did was on all of their receipts, I put the code for the diagnosis. And the reason I did that is so they could take their receipts and they could present them to an insurance company, or if the insurance company wanted to contact me, I could list the date that they were seeing, the fact that it was a 60-minute or a 50-minute appointment, whatever it was, because you can divide appointments by halves too and have half an appointment, and the length of the appointment, and then I would put the diagnostic code and what was this person being seen for. Well, this particular individual in the school system ran into a problem where the secretary of the school wanted to know what a diagnosis was, and just was curious and wanted to know, and said she couldn't process the insurance form unless she knew what the diagnosis was. It was kind of a way, I think, of getting information that she shouldn't have. And the person I was seeing was concerned about this. Do I have to tell her what I'm being seen for? And I says, no, don't tell her. It's none of her business. That's between you, me, and the insurance company, nobody else. And I says, if she pushes it, just tell her everything is in code. And anyone who looks at the code, which would mean any doctor that she saw, any medical professional that she saw in the insurance company, and they all have the right to know and have a need to know, they would know what it was, because everybody uses this manual. And even though it's not the only kind of manual, this is the one that's most used. Not only that, but if they didn't know what a code meant, they can simply look it up. And it'll tell them, and it'll give them all of the characteristics of the disorder, what the person goes through, how they're feeling, what the prognosis is. It has all of that information in it. So there's no reason for you to have to tell anybody what you're being seen for. Anyone who needs to know will be aware of these codes and what they mean, and will be able to look it up if they need to. So with that, she could get by with saying, no, I don't have to tell you, it's all in code, and the codes are on the insurance form, which I would give her, and then she would present that to whatever office she had to, and all they had was the codes. Now, if they were curious enough, they could get themselves a copy of the book, which is very expensive, by the way, and look it up themselves. But nobody would want to do that. It's an expense that you don't need to have. The only people having these books are ones who are going to use them because they are very expensive, but they're also very, very thorough. And I like using it because it gives so much information. Now, you don't use this only when you're diagnosing, because you talk with a person, you see what they're like, how they're feeling, but you can't go by that alone. You need to have a scientific way of codifying what they're going through so that you can present it to an insurance company, so you can justify what your diagnosis is, and it also gives you hints in terms of treating a person with these disorders. So I like having it, I like using it, I think it is good to have it, but I wouldn't judge a person basically just on the DSM itself. It's one tool that I would use in terms of diagnosis. Well, the reason I bring all of that up is that the DSM has its own diagnostic criteria for what drug addiction is and what the drugs are and how to codify all of that. So I'm going to go into what the DSM says about addictions, and it'll make it, I think, clarify it for you. So if we can get to the charts here, the DSM-4 is what I'm using, the Diagnosis and Statistical Manual of Mental Disorders. I'm having trouble with the word statistical. It's not like I'm suddenly become retarded. It is a mouthful to say it. Now, the DSM criteria for substance abuse is this. If you are abusing substances, these are the characteristics that you are going to have. You will have recurrent use of a drug that results in failure to fulfill your obligations in work, in social settings, at home, at school. In other words, you'll be using drugs to the point where you cannot fulfill your obligations. And this would mean absences and poor work performance, and problems in school, problems in neglect of the family, sometimes expulsion from school. In other words, when you see all these things happening, then there's a good chance that the person is on some kind of drugs. We'll get into specific drugs as we go along. I'm going to really get deeply involved in this, and the reason that I'm going to get so involved in it is the fact that we have a terrible drug problem. Everywhere there's a terrible drug problem. And just like I spent weeks discussing suicide and depression when we went into that around Christmas time last year, we are going to go into drugs very, very thoroughly because of the problems that exist. Now, substance abuse in situations where it becomes hazardous, such as driving and operating machinery, that tells you that somebody's on drugs too. Or you have substance-related legal problems, arrests, disorderly conduct, and this kind of thing. You use you have interpersonal problems, arguments with your spouse, fights, all of this. Now, if any one of these, I've listed 4 things here, if any one of these things is a problem, then according to the DSM, you are using drugs, you have a problem with substance abuse, if only one. And you have to have either one for a period of 12 months, though, to be considered to be an abuser. Some people use substances and they get off from it and they don't use it on a regular basis. So if you have any of these characteristics, but you have even one of them, but over a period of 12 months, then you have a problem with substance abuse. Going on from there, this is the DSM criteria for substance dependence. You have abuse, you have dependence, you have tolerance. The DSM classifies all of that. Now, for substance dependence, you have to have 3 or more classes. I have more than that here, and that's your criteria for being dependent on the drugs. If you have drug tolerance, and that means you need greater amounts of drugs as time goes on. if you have a diminished effect from the drug, if you use the same amount of the drug all the time. In other words, you use a drug and you get high off from it, and this is very pleasurable to you, so you want to do it again. After a period of time, you don't get that same effect unless you take more of the drug. At that point, you have developed a tolerance to the drug, and what that means is you have to keep taking more and more and more to get the same effect. And so that means, of course, that you're going to be using more drugs and you're going to get hooked. Withdrawal symptoms will be based upon the drug that's taken. I don't want to say too much about that now, but it depends upon the drug. Some drugs you have terrible withdrawal symptoms. You have hallucinations, you have delusions. Some drugs not so much. Marijuana doesn't give you as much withdrawal difficulties as hard drugs do, because marijuana is not a hard drug. But if you take enough of it, if you become tolerant to marijuana, and you take more and more and more in order to achieve the same feelings, you can have hallucinations from it. It can become a hallucinogenic drug. Usually is not, but it can, depending upon the doses that you take. So I will be going into, I'm going to give a whole list when I do this. I don't know if I'm going to do it in a chart or how I'm going to do it, but I'm going to give you all of the drugs, all of the symptoms, what the drugs are used for, and all of the withdrawal symptoms of the drugs, how long it takes to get off the drug, what it is, and all of that. So you'll have the opiates, the hallucinogens like LSD, which I've talked about before, some anyway, and we'll go through all of them. As I said, I want to do a lot with this because of the fact that we do have a terrible drug problem, and this is worldwide. It's not just in one or two communities. Now I need to get my paper here. There. If you have unsuccessful attempts to cut down on drugs, this would be a sign of drug use. It would be a sign of being tolerant to drugs. If you have unsuccessful attempts, you know you're using too much, you would like to cut back, you don't really want to become addicted, but when you try to cut back, you are unable to do so because you are so hooked on the drug that you can't stop it. You know, people think that they can control it. Well, I've never used drugs, so why don't I try it? Just fool around with it a little bit. I'll be able to control it. I don't use it now. There's no reason why I can't stop. Anytime I want to stop, I'll just tell myself, you're not going to do it anymore, and then you're not going to do it anymore. But it doesn't work that way, because when the drug gets into your system, there are biochemical changes that occur. We've gone into some of this already. And when the biochemical things happen to your body, you cannot talk it away. You have to deal with the situation of a changed body, and what that does is that's not good. You can't get rid of the drug addiction just by thinking it away, just like you can't get rid of mental illness by thinking it away. We tend to think that since we have a mind and our minds work, why can't I just say, okay, I'm not going to feel this way anymore? It's a mind problem, right? And so therefore I should be able to think it away. Well, it's not just a mind problem. It's a body problem that's involving neurotransmitters, all of the biochemistry of the brain and the spinal cord, the glandular system, because they kick in too. And so it's much more complicated than you could realize. And when you get your system involved with it, then what's going to happen is that you can't control your feelings, your desire for the drug, the increased need of the drug, and you find that despite your best attempts to get rid of it, you don't get rid of it. You have to have help to do it. I know some people who are strong that have been able to kick a drug habit just by not using it, but they are very, very strong people, and most people can't manage that kind of strength. Because remember, not only do you stop using the drug, but you've got all the withdrawal symptoms to deal with. And the withdrawal symptoms can be very, very serious indeed, depending upon how much of the drug you've taken and how long you've used and what the drug is itself, because the withdrawal symptoms will be a little different depending upon the drug that you use. Okay. when you spend much time getting the drug, when you try to get the drug over and over again, you're going to the doctors, you're saying, I have this pain in my back, I need help with it, I need some kind of a drug to stop the pain, and they give you a prescription for what you want, you even tell them the drug that you want, then the doctor should suspect that you're addicted. Because you don't walk into a doctor's office and say, I need Darvon. You know, I've got this back pain and I know Darvon will cure it. I want Darvon. You know, the doctor, if they're astute, are going to start asking questions as to why do you want this particular drug, or just to get a prescription, anything that'll numb pain, you'll end up with a drug that you may be addicted to. So if you spend a lot of time getting the drug with doctor visits, then an addiction is an issue here. If you have social and recreational events that you have given up or reduced because of the addiction. Yes, I'd like to go to the picnic. No, I'm not going. I don't feel well. Why? Because you want to stay home and take the drugs. Because it'll be time for you to take the drugs. Because the craving is going to kick in a half an hour and you're going to be gone, and it's not going to be convenient for you to take the drug. You don't want to carry it with you maybe, or you don't want to have anybody suspect that you're on drugs, so therefore you want to keep it hidden. That's a sure sign of drug abuse as well. Continued use of the drug despite the knowledge of the problems that result from it. Now, and I said this before, it doesn't matter how much you know. You can know that the drug is destroying you. You can know that the drug is destroying your health, but it doesn't matter. You're going to use it anyway because you can't kick the cravings, and that's the problem. Well, what about substance intoxication? That's the development of syndromes. Now, I need to explain. Syndromes are a series of symptoms that you get. And it will be typical for an illness. You'll have a syndrome, say, if you have some kind of a mental illness, your syndrome will be whatever symptoms that you have as a part of that mental illness. So you will develop syndromes, that is, symptoms that are typical of a particular drug. And so that is substance intoxication. And you will have changed behavior, psychological changes due to the nervous system changes that you're experiencing, and that would be mood disorders, angry outbursts, things that maybe you wouldn't normally do, but you're doing now because there's been a change in your nervous system, and you're craving the drugs, and you feel you can't do without the drugs, and so therefore you'll do anything to get the drugs. You know, I really feel sorry for people who are addicted because they go through all of this. And a lot of times they kind of fell into use of the drug. It wasn't like they planned it, but they got a hold of a prescription and they liked the effects. And so therefore they kept trying to get the prescription. I'm going to tell you a little story that involves myself here. I'm not addicted to drugs and I don't use drugs. The only thing I ever use are prescriptions that a doctor gives me for medical reasons. But I went to a doctor once and I did have severe pain. And so the doctor gave me Darvon Comp. That's why that drug came to mind. And I took a pill. Oh, I felt terrific. I was on top of the world. This is just one pill. And it changed my outlook, and everything was perfect, and everything was wonderful. It was like I was in the real world, but the real world had changed to be a very, very good place. And I had this extreme sense of well-being, and everything was great. And I thought, this is unusual. But it only lasted for about 10 or 15 minutes, and then I went back to normal again. So it had to be the drug. So what I did was I tried it again. A couple of times. I didn't try it much, and I had the same reaction. And what I realized was it's real easy to become addicted to a drug. If you have one pill that affects you so much, you know, that you feel on top of the world, your tendency is going to want to take that drug more and more and more and keep it coming so that it will affect the way that you feel and you feel better. Well, I realized that, you know, that can lead to an addiction. I just threw the pills away. and I wouldn't take it again. And no one offered to give me another prescription, but if they had, I would have refused it, because I know that this leads to something. You know, this can lead to addiction if you follow it through. And I'm glad it happened, and the reason I'm glad it happened is that it gave me a better understanding as to how easy it is for some people to get involved with drugs. Some people will become alcoholics at the first drink because the biochemistry of their brain is such that they do that. Other people can drink for quite a while before they become addicted, but some people, it's a first drink addiction. This is why I think it's important to stay away from it. If you have a family history of addiction anyway, then I think you would be more in line for it. Well, I'm going to close it here and continue with this next time, because we're pretty much out of time anyway, and I don't want to start something I can't finish. So we'll continue with this, working with drugs, going into all of the drugs, what they are, what their symptoms are, and I'm going to do it from a very clinical perspective. And so we'll just continue with this next time. Please join me then.